Hi, my name is Jan Adam. I'm nurse manager at Harborview Medical Center. Have you ever heard of a sensory room or seen a sensory room? This is a picture of a sensory room that we developed at Harborview Medical Center in Seattle, Washington, where I work on the psychiatric intensive care unit. Costa et al. In 2006 wrote an article about sensory rooms, and the first multi-sensory room that was developed in the 1970s in the Netherlands, and they were designed primarily for people with severe developmental disabilities. Tina Champagne, an occupational therapist in Massachusetts, adapted the concept of sensory rooms for mental health in 2003. She developed a room that was designed to soothe people and to offer people various modalities to help them to calm themselves through their senses. Okay, so research since then has shown that these options have really helped to decrease anxiety in patients, and having sensory rooms on inpatient psychiatric units offers them a safe haven in which they can choose different modalities that help them to calm and learn more skills to decrease their anxiety. In terms of a safe haven, the Sensory Connection website in 2006 printed an article that talked about what makes a sensory room. What do you do to provide a room that makes it appeal to people's senses? And this would be a room designated just for this single purpose. It would be a room just used as a sensory room, and inside this room are furniture, pictures on the walls that are all safe, but designed to soothe, such as rockers for people to sit and rock, pictures on the walls showing beach scenes and mountain views, and within that room would also be different modalities that they could utilize, such as essential oils, music to play, weighted items such as weighted blankets and weighted bears. People can go into this room and learn ways to calm themselves. This is a choice. They choose to go into the room. The room would not be locked from the inside. They could leave when they wanted to, but it would be locked from the outside to prevent people from interfering or coming into their space while they're utilizing this room. They can choose when they come in what alternatives they want. It's kind of a trial and error thing where they can pick and choose the different alternatives that are there to see what helps them to calm and what doesn't. And so they basically can use the room as a timeout space with things that make them feel good. It does seem to decrease their sense of anxiety, and I have shown some graphs here. This one is from the Sensory Connection, printed in 2006 from their website. This is from research that was done at the University of Massachusetts Memorial Hospital over a period of 1 year. This is patient reported sensations of anxiety. Over 1,100 visits to this room occurred over the period of a year, and you can see that patients reported increased anxiety before they went into the room and a significant decrease in anxiety after they used the room when they were out. On this side is another graph that was presented in the American Psychiatric Nursing Association conference in 2011 in Anaheim, California. Myself and Tim Meeks were the presenters for this, and we demonstrated this graph for a QI project that we did. This is objective staff report of anxiety based on viewing patient behavior. And again, before the patient used the room, their anxiety level appeared to be at a 2. When they left, after they got out of the room, it was a little under 1.5, so a significant decrease in behaviors that indicate anxiety after using the room. The use of a sensory room in an inpatient psychiatric setting has been demonstrated to provide a safe haven for patients to explore alternative techniques to help them to decrease their anxiety through sensory modalities. In conclusion, many inpatient facilities are now utilizing sensory rooms. The Joint Commission on Accreditation of Healthcare Organizations is now endorsing the use of sensory rooms in inpatient psychiatric units as a way to decrease the use of seclusion and restraints. This was reported in an article again in the Sensory Connection website in 2006. The evidence strongly supports the effectiveness of sensory rooms in decreasing patient anxiety, giving them a safe place to learn skills and help them to have more control over their behavior. Are there any questions?
Does a patient use this room when really angry?
We try to help patients use the room before they get really angry. The idea is to intervene in anxiety early. If you can intervene early, you are more likely to avoid them getting really angry or agitated. So we encourage them to use it before they get really angry. If they're really angry and they want to use the room, we assess them for their ability to be safe in the room.
What are some of the senses you talk about, and what would you use to help keep calm?
Well, there's the usual senses that we think of. So there would be hearing, auditory, so again, music, different kinds of music that they have available to them. Visual has to do with the pictures on the wall, the water feature, the bubble light. Taste would be hard, sour candy. Hard, sour candy tends to be activating. Sweet tends to be more calming. We have vestibular, which has to do with rocking. And so your rocking chairs, the little sit-up rocking chair, there's that big foam rocking chair that's really helpful because it sort of envelops them. And then we have something called proprioception, which is kind of weight on bodies, and that's been really effective. We have weighted blankets and weighted bears that patients really can respond to, especially people with cognitive impairments respond really well to that weighted bear. Any other questions? Thank you.